The number one killer of women in America is not cancer, is not breast cancer, it's not cervical cancer, it's not ovarian cancer, but it is heart disease, coronary artery heart disease. That's the number one killer of America, and that's why I want American women to listen up to my message. The symptoms of coronary artery disease or unstable plaque angina, which means just, chest pain that is associated with heart disease, they present very differently in women. Women tend to report symptoms like an ache, a discomfort, not something as severe as somebody sitting on their chest. That's usually how symptoms are presented in males. So we have to be very astute in the nuances in how women communicate a really serious condition that is the number one killer. In fact, 700,000 people die every year in the United States from heart disease, both men and women. So I'd like to tell you some really weird symptoms that can be a peek into this disease. For example, if you have chest pain, discomfort, ache, difficulty breathing, pain radiating into your jaw or into your shoulder or into your back. If you have diabetes, you even have like weirder symptoms, which is like nausea or abdominal pain. But make sure that these symptoms are worse with physical activity like walking, and then they get better when you sit down. That makes it more consistent with chest pain that is related to the heart, your heart health. This is very different than nausea or abdominal pain from acid reflux, because it wouldn't get worse with activity and then better when you sit down. And usually acid reflux chest pain usually is after eating, like worse after eating, several hours after eating, or when you're lying flat on your stomach, lying flat on your back after your meal. And then shoulder pain. Shoulder pain can usually be from, like, for example, like inflammation of the shoulder, and that's usually not chest pain related. However, if you have shoulder pain that is not provoked, that is not triggered by moving your shoulder, like overhead activities, like going behind your back to take off something, or taking off your shirt, or opening a doorknob, if it's related to pain just by walking, like if you have shoulder pain just by walking and it gets better with rest, and that could be a potential sign of heart disease. So it's really important to look for symptoms. Anything that gets worse with physical activity like walking or vacuuming or lifting, and better with rest, complete rest, and it's one of those symptoms like neck pain or chest pain, difficulty breathing, like your difficulty breathing is always worse when you're physically active and better when you completely rest. Those are possible symptoms of heart disease. And if you're diabetic, be very wary of nausea when you walk or exercise. That's not a good sign. You should see your doctor.